So autism is a behavioral developmental disorder that includes deficits in social interaction and social communication, and also included in the definition is repetitive and restricted behaviors. Okay? Now, Fragile X is a genetic disorder. It is caused by a mutation in the Fragile X gene, also called the FMR1 gene. It is actually the most common single gene cause of autism. And the majority of individuals with Fragile X syndrome, that is 60% of the boys and at least 20% of the girls, meet the behavioral definition of autism. So there are many, many patients that have autism caused by Fragile X syndrome. So they have both Fragile X syndrome and autism. And when we compare those with Fragile X syndrome plus autism compared to those with Fragile X syndrome that don't have autism, those with autism, of course, have worse social interactions, but they also have a lower IQ and a lower adaptive skills also. So they are lower functioning compared to Fragile X syndrome without autism. But again, the majority of individuals, of boys with Fragile X syndrome, have autism. Usually individuals with Fragile X syndrome are delayed in language abilities. So typically they're not talking by age 2. Sometimes they have more tantrums. They're usually hyperactive, very sensitive to noises in their environment, often plugging their ears, and they oftentimes hand flap or hand bite. They oftentimes, if they are verbal, they can perseverate. That means asking the same question again and again, or perseverate in watching a certain part of a video. So they have many features of autism, even when they don't meet all the criteria for autism. Most kids with Fragile X have problems with making direct eye contact because that's very stimulating to the amygdala in the brain. So they will look away. It's hard for them to look you straight in the eye. Whereas children with idiopathic autism oftentimes don't have the same problems with eye contact. So kids with Fragile X also can be tactilely defensive, pull away from touch. They sometimes don't like to be touched, although usually they're pretty huggable. But the hand flapping and the speech patterns with lots of repetition or perseveration, the hyperactivity, the poor eye contact, these are features that tell you that they should be tested for Fragile X, along with their language delays. Why would you want to know about the Fragile X diagnosis? You want to know because this changes treatment. Once you have a Fragile X diagnosis, you can use a targeted treatment for Fragile X. The treatments that I mentioned about metformin, sertraline, CBD, and there will be many more targeted treatments in the future. So this is critically important. And also this mutation affects many family members, not just the child. When the child is positive for Fragile X syndrome, the mother is the carrier, and she either has what we call a full mutation or a pre-mutation, and she got it from one of her parents, either her mother or her father. And these problems with FACS tests that I mentioned, tremor and balance difficulties, are seen in one or the other grandparents, almost always. So this is critical for all generations in the family to know about, because there are treatments for all of these conditions. And this will help the health problems that the family has had. The carrier state can get migraine headaches, high blood pressure, restless leg syndrome, fibromyalgia, chronic fatigue, chronic pain. all kinds of problems besides early menopause and FACS-TAS, or the tremor balance problems. So it is critically important for the whole family to know, and also they can prevent a Fragile X syndrome diagnosis in a future pregnancy. There's new reproductive technology that can help the family have normal children if they so desire.